So at Maru, Maru Matchbox, I have with me Kyle. Kyle, would you like to introduce yourself and give us a little bit more detail?
Yeah, hey, Brent, thanks very much, and thanks, Kenneth. That was really, really interesting. So my name is Kyle Davies. I'm an SVP and head of syndicated research with Maru, and I've got about 6 or 7 minutes just to share with you some interesting stuff from the work that we've been doing of late. And really, like many of you on the phone, and certainly like all of the presenters here today, we've been over the past couple of months highly focused on work to help our clients just understand COVID and how to navigate these uncharted waters and how to come out, on the end as strong or even more strong as a brand than what they were going in. So we've been tracking a whole bunch of stuff, at least twice weekly, back to mid-March. How are consumers feeling? What are they thinking? What are they worried about? How are they doing? And how are all of those things impacting the way that they are and the way that they will engage with different brands, engage with different sectors, and kind of reintegrate slowly over time into society and into the economy. And so over the last couple of weeks, we've really shifted gears where the first month and a half, 7 or 8 weeks, we were really focused on understanding the now and what is COVID like and how are people behaving now and how has their behavior changed? How are they thinking? What are they worried about? And over the past, I would say 3 or 4 weeks, we really shifted gears as our clients have to want to understand not only what people are thinking and feeling right now at this point in time, but how is that going to translate into the other side of COVID-19? Which of the behavior changes that we have taken on during this time are going to hold, which are going to revert back, and just how exactly can our clients most successfully come out of COVID successfully? And so in order to do that, we've really employed a wide range of proprietary tools that we have at our disposal. And we know that it's really, it is tough to predict what people will do. It's tough for people even to predict what they themselves will do in the future. And so we really work hard to employ a variety of different tools to help us understand not only what people are thinking, but also how they're feeling at a point in time, because we know that understanding the think and the feel together will give us the best understanding of the behavior, why people are doing what they're doing, and what will they be doing in the future. So we're really working hard to bring the feel and the think together in all of the ways we do both for clients as well as in our COVID tracking. So I wanted to share with you a couple of what I thought were pretty interesting findings over the last couple of weeks, centered on some questions that we've asked people around just getting back out there. So again, not kind of how are you feeling right now, but more focused on their thoughts and feelings about re-engaging in the economy, re-engaging in society. So one of the ways, and this is a pretty busy slide, but I will focus in a little bit on a couple of areas specifically. But one of the things that we really wanted to do first off was just ask people, how are they thinking about re-engaging with society and re-engaging with different activities in society? And so we just asked them straight up using a scale of, from the far left, the darkest blue is this is okay now, to the far right, the darkest gray is I'm only going to be comfortable doing that thing once there's a vaccine. And then there's a couple of different less strong viewpoints in the middle there. And so the first thing that we noticed was, there is a pretty big difference in people's comfort level with re-engaging in different areas of society. So towards the top here, we have a higher level of comfort with things like getting together with friends or family. More than a quarter of Americans already say that that's okay now. And an additional 22% for a total of, around 50% are saying it's either okay now or it's going to be okay once the outbreak is under control. I don't need to see no cases for 2 weeks or no cases for 4 weeks, and I certainly don't need to see a vaccine before I'm going to be comfortable getting back together with friends and family. And some of the other things that are higher on the list, and therefore people are more comfortable with already, things like going to work at an office, going to a park with others who are not in your household, getting a haircut, for example. Those are the things that people seem to be most comfortable with right now. And then at the bottom, the things that people are less comfortable with, and therefore, the areas of society and the industries that I think will have more of a struggle opening back up. Things like going to live events, so professional sports and concerts, where we see nearly 4 in 10 Americans telling us that they feel like they will only be comfortable doing that thing once there is a vaccine. Another one being about the fifth or sixth one up from the bottom, flying with a commercial airline. 36% of Americans say that they're only going to be comfortable doing that thing once there's a vaccine. So notwithstanding the differences that we see from the top to the bottom of this list, one really overall finding that I thought was interesting is that we've got meaningful percentages of people who are going to be, or at least say now that they're going to be taking it very slow and very easy as they ease back into the economy. They need to see progress from a health standpoint. No new cases for 2 weeks, no new cases for 4 weeks, or in some cases, I'm not even going to do that thing until there's a vaccine. But we also know that, as I said, it is hard for people to predict what they're going to do. And so, yes, 39% say they're not going to be comfortable going to a concert or a sporting event until there's a vaccine, but is that really the case? Are people really going to wait till there's a vaccine to go on vacation? Or are really going to wait till there's a vaccine to go to a business conference? We've seen a lot of conversation out there in a variety of different mediums that kind of say, yes, it makes sense that people are thinking that right now, but I think that over time, people's guard will come down. And people say that they're not going to fly on an airplane until there's a vaccine. I think most people will, and there's a lot of thought that is the case. So really, the question is, as I said, will 36% of people actually wait until there's a vaccine to fly on a commercial airline? Will 33% wait until there's a vaccine to go on a business conference? Because if so, this has meaningful impact on the kind of the speed and the success with which the travel and hospitality industry is going to be able to come out of this. And so what we wanted to do was to use, similar to some of what Ken had talked about, was to use our IAT methodology to understand not only what people think, but also how they feel, so that we could uncover maybe the answer to that question, which is, will 36% of people wait for a vaccine? So we used our IAT to kind of chart people's comfort level with getting back out into society in two different ways. So we charted it on a 2x2 here, where the x-axis is the extent to which people are excited to get back to doing that thing. So the further to the right an attribute is, or a dot, the more excited people are to get back to doing that thing. And then on the y-axis is the extent to which people, through our IAT, are implicitly worried from a health perspective of doing that thing. And so I think this provides some interesting context. What it shows is a lot of similarity in the ways that people answered, both from a stated perspective or a scalar perspective, which is what I showed you first, and then an IAT perspective. So largely what I'm seeing is that people at this time have a good handle of their emotions and their feelings. But really the implications here are pretty interesting. If I'm an industry in the lower right-hand quadrant, so one of those things is just getting out and about. That was the thing that people are most excited about. But coffee shop and fast food is also down there. If I'm an industry in or close to that lower right-hand sector, I might be able to expect people to come back to my business and back to my industry more quickly for two reasons. A, because they're more excited to do so. They can't wait to get back to their coffee, but also because their implicit level of worry or concern is lower than it is for other things. The interesting one is in the upper right-hand quadrant, where people are really, really excited to get back to sit-down restaurants. They're really excited to get back to just going shopping. They're really excited to get back to the hair salon, but they also have a high level of implicit concern with doing those things. And so I think two things are going to happen there. A, we're going to have a group of people who are just willing to put themselves at risk. I know it's risky. I feel it's risky, but I'm so excited to do it, I'm just going to do it. And B, I think also we're going to have a group of people who are more willing to take safety precautions, wearing masks, wearing gloves, social distancing, in order to get back to doing these things. In the lower left-hand quadrant are the things that people are less worried about, but they're also less excited about. So there aren't any, there's not a huge barrier there per se to going back because the perceived risk is low, but also the excitement is low. So people will get back to doing these things in their own time, but they're certainly not going to be rushing to get back out. And then the industries that I think are going to have the biggest struggle, and we saw this in the stated and now also in the IAT, are in the upper left-hand quadrant, where the excitement level is lower to get back to doing these things, and the implied level of risk or worry is higher. So things like vacationing, going on an airplane, going to a concert or a live show, et cetera. Those are the areas that are going to have trouble getting back out. So For some of our clients in the travel and hospitality sector specifically, because we had been noticing those things in our questioning, we've also started to utilize our IAT methodology to help them understand how they can start to communicate with clients, how they can maybe convince them to come back to their sector more quickly than they otherwise would. And really the story here continues to be that it is going to be a difficult road back to normalcy for certainly travel and hospitality, but also other sectors as well. You know, we see high levels of people not only agreeing, but implicitly agreeing that they're going to take it slowly when easing back into travel, that they're going to be nervous about crowds when they get back into travel, that they're going to be more choosy about the places that they travel. But, you know, within this kind of pessimistic point of view, we also do see hints of positivity, or at least opportunity for airlines and companies. So number one on the list here is I'll travel with airlines that take passenger health seriously. So those airlines who do the best job of communicating what they're doing from a sanitary and health perspective are going to be able to perhaps convince people to come back earlier, or at least convince people to travel with them as opposed to their competitors, because that level of implicit agreement is so high with that attribute. We also see, though they're not kind of highest on the list here, we see 42% of people implicitly agreeing that they can't wait to travel again. We see a lot of people telling us 49% implicitly that they're going to appreciate travel much more than they did before. And so despite the overall story, which is that it is going to be a difficult road back to normalcy for many clients, and in particular travel and hospitality, we do see some rays of hope or some rays of opportunity. And the way that we're helping our clients get at those things is through combining our System 1 and System 2 tools. We've got a ton more. We are in field twice every week, and we're testing a whole bunch of different things. But I wanted to share with you a slice of some of the more interesting things that we've been finding over the past couple of weeks.
Great stuff, Kyle. Well done. It's interesting to look at the explicit versus the implicit, because it tells the additional layer, of what really drives human beings to do what they're doing. So I do have a few questions before moving on. So first one would be for companies that are looking to start marketing, more aggressively. You started to allude to this sort of towards the end. Are consumers saying anything about how they're reaching, to marketing these days, or reacting to it at the end of the day?
Yeah, so when we first started tracking kind of in mid-March, and even increasingly so over the first month of tracking, though there were people who said just kind of continue to market to me, continue to communicate with me like normal, we were seeing high numbers of people and increasing numbers of people saying, I don't want to hear about things that aren't specifically related to my needs during COVID. But those opinions, though they were increasing for the first month of data collection, they've really been falling more recently. And then specifically over the past couple of weeks, we've started to test different elements that people or the companies might include in their marketing. So, and really it's telling a story of like a nuanced story that people definitely do want to be marketed to. And in many ways, they want that marketing to just kind of look and feel like normal. But there does need to be a nuance. It needs to be careful. So messages like thank you to first responders, that was the specific form of messaging that actually resonated most with Americans. But then right behind that was tasteful humor. People want to laugh again. They want to see some of the stuff that used to be in marketing that they haven't seen for the past couple of months.
Yep, great. One more question, just to keep us all on time. Did you ask any questions around anything dealing with people coming into their own home? So this could be professional services, it could be internet installation, home improvement. Do you have any of that data within the reporting?
I don't have it quantitative, though. It's a great idea, and I'm going to jot that down and perhaps add some questioning to our tracker that's in field again tomorrow. I mean, I know anecdotally I've heard a lot of stories of people who are inviting hairdressers to their backyard on their back deck to kind of cut their hair, and their entire family and slew of friends. So I know anecdotally we've been seeing more and more comfort with having people at least to the property, if not in the home, but I have not asked about that specific. It's a great idea, though. We'll start asking that tomorrow.
Good stuff.